So today we're going to be talking about ADHD in the brain. October is ADHD Awareness Month. So I'm sure you're hearing through different avenues about the hot topic of ADHD. So today we're going to talk about what is going on in the brain of someone that has ADHD. There's so many things out there and there's so many resources out there, but really to have a better understanding of, okay, not just the symptoms that you're seeing, maybe as a parent that has a child that you're concerned about, or maybe you're an adult that you are struggling and you have some concerns. But today we're going to talk about not just the symptoms, but really what's the root of the problem and why is your child struggling? Now, we have several centers participating in today's webinar. We have Chula Vista, Encinitas, Palmdale, Redlands, and San Diego, California. We have Norwalk, Connecticut, Wilmington, Delaware. We have Central Florida, Coral Springs, Jacksonville, Naples, Palm Beach, and West Chase, Florida. We have Peachtree City, Roswell, and Suwanee, Georgia, Edwardsville, Illinois. We have Plainfield, Indiana, Overland Park, Kansas City, Wichita, Kansas. We have Louisville, Kentucky, Oakland County, Michigan, Chesterfield, Missouri, Woodbury, Minnesota, Omaha, Nebraska, Summit and Bergen County, New Jersey, Plainview, New York, Charlotte and Cornelius, North Carolina, Columbus and Cincinnati, Ohio, Wexford, Pennsylvania, Mount Pleasant, South Carolina, Farragut and Nashville, Tennessee. We have Allen, Fort Worth, and Lubbock, Texas. We have Midlothian and Glen Allen, Virginia, and we have Mequon and Fox Valley, Wisconsin. So there are two ways that you can interact with us today. If you have a question, there's a Q&A box. Feel free to ask questions. We have moderators on that will be answering your questions. Also, if there's time at the end, I'm going to answer some questions live today. But then also, there are some phone numbers in the chat that we've posted for you that you can actually text the centers right now, and they have directors that are on live to answer maybe some personal questions that you don't want to ask in public, and that's absolutely okay. So we just want you to feel comfortable interacting with us, and there's lots of different ways you can do that today. Here's the next poll question for you. Do you have a child, a young adult, or maybe yourself have a formal diagnosis of ADHD? This is something that's really helpful for us, but what's really oftentimes in our brain balance centers is we serve a lot of children and young adults that have ADHD, but we also serve a lot of students that don't have a formal diagnosis, but yet the parents are concerned. They're seeing symptoms. They may be struggling academically, socially, and emotionally. And so maybe they don't have a formal diagnosis yet, but yet they have concerns. And that's the cool thing about brain balance is you don't have to have a formal diagnosis because we really look at the root of what's going on in the brain of a child or a young adult that's struggling. So sure enough, this is always fascinating to me. 57% of you guys say yes, you do have a formal diagnosis of ADHD, but 43% of you guys say no, that you don't. And so that's okay. If you just have concerns, or maybe you're a professional on listening in, and if you are a professional, let's say you're a therapist, you're an educator, you're a pediatrician, you're a nurse practitioner, if you want to put your information in the Q&A box, your name, an email address, we would love to send you special information specifically for professionals. So that's something too that we would love to connect with you as well. So welcome our professionals. All right, let's first start with, well, what is the criteria for a diagnosis, right? There is this book, it's a very thick book called the DSM-5, and it's basically diagnostic criteria for a child or an adult to be diagnosed with ADHD. And here's what it says, and this is from the CDC. It says people with ADHD show a persistent pattern of inattention and or hyperactivity and impulsivity that seriously interferes with functioning or development. There is clear evidence that the symptoms interfere or reduce the quality of social, school, or work functioning. So again, it's something that you have to see symptoms in multiple areas that are hindering and reducing the quality of social, school, and work functioning. And it's inattention, hyperactivity, and impulsivity. But here's what's interesting. More and more research continues to come out related to the topic of a diagnosis of ADHD or symptoms of ADHD. Harvard Medical School and the Department of Psychiatry actually states that although common, ADHD is a serious disorder, it's also associated with other things. Matter of fact, the research shows that someone with ADHD or symptoms of ADHD have 10 times likely more incidence for antisocial personality disorder. And what we find is oftentimes, especially in children, they can initially be diagnosed with ADHD when they're younger. And then as they become older in middle school, high school, young adult, college age, into adulthood, the diagnosis can change based on the child's symptoms. So these are just risks. They're 15 times more likely to be at risk for drug abuse, 25 times more likely for institutionalization, for delinquency. They're 19 times more at risk for incarceration. So all to say that there's a higher risk that they are seeing a correlation between the diagnosis of ADHD with other challenges. And here's also what's interesting is that the symptoms can look different in girls versus boys. Okay. In girls, sometimes their ADHD symptoms are less disruptive. Okay. They may not be as obvious that they're struggling initially, because girls oftentimes can internalize their behaviors, meaning that you can see an increase of anxiety as the child becomes older. So again, hitting where maybe when they were younger as a little girl, they can look more inattentive or impulsive. But then as they hit middle school and high school, it can shift to looking more like anxiety. Girls are more at risk for depression. Also, it can look as a struggle related to academic underachievement. They also can look just more emotional sensitive. They just respond more with emotions. And they can have symptoms of like mood instability where they're responding out of emotions versus reasoning. And it also can impact self-esteem when it comes to girls. Whereas boys, they can tend to externalize the behavior. So you can see an increase of impulsivity. You can see an increase of aggressive behavior, difficulty staying still, talking excessively, just being silly too. A lot of times when boys are younger, they can be really silly and they interrupt others and they think it's funny. But then again, as they become older in middle school and high school, that interrupting others can become more abrasive. And that's where you can see more of that ODD type behaviors that take place. But here's what's also interesting, and this is from the ADD Attitude magazine, where they've also brought out some research that, and what I love is that it's a picture of an iceberg, and you'll see that we use a picture of an iceberg a lot, where the tip of the iceberg has a lot of obvious symptoms of hyperactivity, lacking emotional control, inattention, and focus struggles, because that's really the primary kind of symptoms that are connected to a diagnosis of ADHD. But what's really interesting is that more research is coming out talking about that children and young adults and adults with ADHD, it's actually a lack of brain connectivity, which we're going to talk about what that means and why is that happening. And so because of a lack of brain connectivity, you can actually see other symptoms that are related as well. Maybe they're not so obvious, but what the research is showing is that there's a 50% chance that they have other symptoms that are outside of the classic diagnosis of ADHD. For example, sleep disturbance, where maybe your child doesn't sleep well, or poor executive functioning skills in teenagers and in adulthood, where it's like setting goals and then being able to follow through on those goals, or multiple step directions and being able to handle multiple step directions, or perhaps lower frustration levels, or just like we talked about, anxiety, depression, OCD, ODD. Those are all other types of diagnoses and symptoms that actually can also be related with a diagnosis of ADHD. And yet, oftentimes, those are things that may not be as prevalent initially when you get a diagnosis of ADHD. Here's a poll question for you. ADHD can impact many areas of life. Where is it impacting your child's life the most? Or if you're an adult and you're struggling, where does it impact you? Is it more related to socially, behaviorally, academically, maybe at home, maybe day-to-day functions, or all of the above? And then the next question is, how significant do you feel like the impact of your child's struggles are? 5 being severe and significantly severe, 3 maybe being moderate, and 0 being none at all. All right, so those are the questions we want you to engage with. But all to say, today we're going to talk about, why does it impact different areas of life? What is the root cause of that happening? And then also, what can we do about it? The good news is that the brain can change. So if the research is saying that there's underconnectivity in the brain, the good news is guess what? The research also says that we can improve brain function, that the brain can continue to develop throughout a person's entire life. So it's never too late to be able to improve brain connectivity and to be able to see improvements. So let's see what you guys have to say. Wow, it's a little spread. So basically, you guys are saying that 41% are saying behaviorally, 44% is saying it's impacting academically. So those are the two big areas, academically and behaviorally. So we'll talk about that. And then 28% is saying socially, day-to-day functions is also 28%. 35% of you guys saying it's impacting all of the above. And then 27% saying at home. And then sure enough, the majority of you guys are saying, yep, number 4, as far as severity and significance of the struggles. And that's pretty common, and we hear that often in our centers. All right, so let's talk about why. So as you see, there's another picture of an iceberg, and I love to utilize a picture of an iceberg because, again, the tip of the iceberg is literally what you're seeing and what you're experiencing as a parent, perhaps, or as a person, a young adult that's struggling. You could have difficulties, your child can have difficulties with losing things, poor grades, long homework times, doesn't complete homework assignments, lacking self-control. So the behavior, the meltdowns, like you guys are saying, the impulsive behavior where they're not thinking before they're acting, right? It can impact them socially as well. So I want you to think about, just as a parent, what you're dealing with every day, and think about what your child is struggling with. What are the symptoms that you are seeing? And I want you to put that in that tip of the iceberg, all right? Because that is the visible symptoms. That's what you're experiencing. That's what you're seeing. That's what your child's experiencing. But there's so much going on in their brain that you can't see. And so that is something that we look at Brain Balance, because to have optimal processing in the brain, okay, your child has to have optimal processing in their brain. They have to have optimal connectivity in their brain to have a teachable brain. I often say that a connected brain is a teachable brain. All right, a connected brain is optimal processing. And that's what we really have to look at when we're looking at the symptoms that your child is struggling with. Why are they struggling with those symptoms? Well, just as I shared, the research says it's a lack of brain connectivity. There can be underdevelopments in their brain and even overdevelopments in their brain that's impacting the cross communication of the brain, that's impacting that processing. And so again, a connected brain is a teachable brain. All right. And so you have to have optimal processing for your child to be able to learn academically, but also socially and emotionally. All right. So that's something that is really critical. So, how does a typical brain develop to have optimal processing? So, the first thing that we look at brain balance is we look at things from a developmental approach. Okay. How is your child's brain developing? Where are their strengths in development? And are there any underdevelopments that's impacting processing in the brain? All right. So, the first thing we look at is we look at primitive reflexes. Now, primitive reflexes are involuntary motor responses that originate in the brainstem and they present after birth. Okay, so every baby is born with primitive reflexes, and you want them to have these survival reflexes because their brain isn't fully developed. So there's a lot of involuntary motor responses that actually are there for survival. All right, these are central nervous system motor responses, and they are present at birth. But then, as your child's brain begins to develop, all right, and how does the brain develop? The brain develops through their sensory systems. So, what your child sees, hears, smells, and feels. So, senses develop the brain, and then motor develops the brain, gross motor, fine motor. So, again, primitive reflexes are important at birth, okay, and they're involuntary motor responses that are present at birth. But then, as your child's brain is developing, through their sensory systems and their motor systems, then these primitive reflexes actually should be inhibited and should no longer be active. All right, and they should be inhibited by at least a year old. All right, they usually say between 12 and 18 months, all of these reflexes should be inhibited. So, for example, when you put your finger in a baby's hand, they automatically clench to your finger. That's called the palmar reflex, okay? And that is a survival reflex, all right? Because that baby's holding on to your finger, all right? But through sensory development and motor development, these reflexes should be inhibited. They should no longer be present any longer. However, what the research shows is that a child that struggles with learning or struggles with behavior, oftentimes primitive reflexes still can be active, which is a sign of underdevelopments in the brain. All right, so here's an example. When we're thinking about how does primitive reflexes impact brain development, which can then impact motor development, which can then impact a lot of different areas of functioning. All right, there's a primitive reflex called the tonic labyrinthian reflex, and this can impact the development of your child's gross motor systems. All right, so then if there's a weakness in gross motor, which is critical for optimal brain development, then you can see other signs and symptoms of a weakness in multisensory processing, a weakness in focus and the ability to drive, difficulties with hand-eye coordination, difficulties with maybe learning how to ride a bike or playing sports or just having good body awareness, which if there's a weakness in body awareness, that's when you can also see a weakness in empathy and the development of empathy, because your child has to be able to physically feel their body to be able to connect to what they're feeling versus what they're thinking. And so oftentimes you can see a lack of empathy if they have a lack of insight and body awareness. So again, a child that has a primitive reflex that has not been integrated, it impacts brain development. It impacts the gross motor development, which then can impact other areas. So one of the things that we were talking about in the beginning here, is that with ADHD, you can see other symptoms that you may not connect to specifically ADHD. But if you think about it, where is your child when it comes to gross motor skills? What does their muscle tone look like? What does their body awareness look like? Are they space invaders? Are they impulsive with their motor movements? Are they well coordinated? Because again, like I said, gross motor is really key for optimal processing in the brain. Gross motor is really key to have a connected brain. A connected body and a coordinated body is a coordinated brain. So if you see a weakness in gross motor functions, that actually is a sign and a symptom of underdevelopments in the brain, which will then impact the way that your child's brain is processing, which will then cause symptoms of difficulty with focus, attention, impulsivity, difficulties with behavior. So as you can see that if we want optimal processing in the brain, we have to have optimal gross motor development. We have to have optimal sensory development. So what your child sees, hears, smells, and feels develops the brain, and then motor develops the brain, gross motor. And many times when we're talking about gross motor, we focus on it when they're babies, right? When they lift their head, they roll over, they sit up, they crawl for 4 months, they stand up and they walk. However, motor and gross motor skills have to continue to develop. So that's why I always ask, like, how is your child's motor skills compared to an 8-year-old, compared to a 9-year-old? Do they, are they competitive? If they're on a basketball team or they're on, a soccer team, what are their motor skills compared to other kids? Because if you see a weakness in motor development, those are that's a sign and a symptom of underdevelopments in the brain. So gross motor develops the brain. And then also we look at fine motor. And so there's a primitive reflex called the palmar reflex, which impacts the development of fine motor skills. And if there's a weakness in fine motor functions, that can impact their handwriting. That can impact the speed in which they write. It can also impact like buttoning and zipping and snapping and grooming and getting dressed and eating appropriately. So you may see signs of symptoms of like them being a messy eater or their clothes just being disheveled, right? And they're struggling with just basic grooming, or you're constantly having to say, get dressed, go get your clothes on, and you're having to remind them multiple times. So all to say that when you're seeing these type of symptoms, a lot of times there's things going on underneath that's impacting how their brain is developing, which will impact this processing in the brain. So you can see that gross motor development, big motor movements develop, and then fine motor movements develop. So now your child, even when they're smaller, they're running, and then of course they have a grasp. And then when they start coloring, they're coloring, sometimes they're coloring on the wall, right? And you're like, oh my gosh, you just colored all over my wall. I'm going to have to repaint it. But then again, their grasp changes as they turn 4. They're coloring in the lines more on, a coloring book. Their writing is crooked and big at first when they're in kindergarten. But then again, as they become older, 1st grade, 2nd grade, 3rd grade, their handwriting should become more sophisticated. It should become smaller. It should be legible, right? So fine motor skills also need to develop to have optimal processing in the brain. So we have to look at all of these areas because it's really key and critical. If the research is saying, okay, a child that has ADHD and symptoms of ADHD, the root issue is a lack of connectivity in the brain. And then what is connectivity? Connectivity in the brain is you have to have optimal processing in the brain. So it's like, okay, how do we have optimal processing? Well, your child has to have optimal development in all of these areas. Their primitive reflexes need to be inhibited. Their sensory systems, what they see, hear, smell, and feel, needs to be at optimal development. Their gross motor skills need to be at optimal development. Their fine motor skills need to be at optimal development, because here's the thing. There's a primitive reflex called the asymmetrical tonic neck reflex, which is responsible for the development of the visual system. Your child's visual system is a bunch of fine motor movements of the eyes. Just yesterday, I was meeting with several different parents in parent meetings, and it was like the day to talk about the visual system and how their eye motor movements are really critical for focus and attention. Your child has to be able to fixate their eyes. They have to control their eye motor movements. Okay, that's the foundation for what we call ocular motor development. And so they have to be able to fixate their eyes. If they're not able to fixate their eyes are all over the place. They look very inattentive, and you're constantly saying, look at your paper, look at your paper, look at your book, read that again. You might be having to like have them follow with a finger to be able to track for reading. Because again, when there's an active primitive reflex, example, asymmetrical tonic neck reflex, it inhibits the development of their visual system. And then you're going to have a weakness in eye fixation. They're going to have a weakness in eye tracking, difficulties, what we call convergence and divergence of the eyes, which is really key for like looking at the board at school and looking at their paper and taking notes. And then guess what? You're going to see symptoms of difficulty with focus and attention, difficulty with taking notes from the board. Maybe you get home their paper and you're like, what are we supposed to be doing? You wrote half of the directions down and I don't understand what else we're supposed to do. And then, right, they look at you and you're like, they can't remember what they're supposed to do. Because maybe while they were in school and in that classroom, they were trying to listen to the teacher, they were trying to write down information, they were trying to gather all of this information, and yet their brain is not able to take in all of that sensory input at the same time because there's underconnectivity taking place in the brain. So these are things that we have to look at when we have an understanding of why your child is struggling. So we look at things from a developmental perspective, but then we also have to look at things from a hemispheric perspective because there's two hemispheres of the brain. There's a right hemisphere and there's a left hemisphere. And I always say a balanced brain is a teachable brain. A connected brain is a teachable brain. And here's the thing, the right and left hemisphere, they need to be equally developing. They need to be constantly communicating, and we need to be building strong neural pathways or strong highway systems between the right and left hemisphere. Now, the right hemisphere and the left hemisphere have complementary functions. Okay, I oftentimes like to explain, think of your left hemisphere as like a gas pedal. It's your processing hemisphere, or it's your go, go, go hemisphere. It's that ability to remember facts and details. It's about verbal communication. It's about logical and linear thinking. It's about pattern recognition. So that's more of the left hemisphere, whereas the right hemisphere, think of it as like the brake pedal of the brain, the ability to stop and think before acting. It's the ability to read facial expressions and nonverbal cues. It's that ability to be able to have gross motor development. Body awareness is housed in the right hemisphere. It's the ability to physically feel your body. So right brain and left brain have complementary functions, but at the end of the day, they need to be cross-communicating. And the way that they cross-communicate effectively and efficiently is they need to be equally developing. Oftentimes at Brain Balance, we serve children that have extreme strengths, but then also they can have weaknesses. They can actually be functioning above their chronological age in certain areas, and then yet in other areas, they can actually be struggling. And so if you see a skill set and an imbalance in skill set, actually that is a sign and a symptom of an imbalanced brain, where one hemisphere of the brain matures faster than the other, and then literally one hemisphere can become overworked, and the weak side can become weaker. And so this is where you can literally see an imbalanced brain, which if you have an imbalanced brain, you're not going to see optimal connectivity taking place, and then that's going to impact the way your child is processing, their brain is processing. And so that's when you can see symptoms of ADHD. Dr. Barkley, he does a lot of research when it comes to ADHD and self-regulation and even executive functioning. And what's so fascinating is at Brain Balance, we often talk about brain age versus chronological age. And here's what his research is saying, that children with ADHD are on an average of 30% behind regardless of their IQ, meaning that intellect and their IQ can be average or even above average but what they are actually performing is 30% behind. So even though their chronological age is 4 years old, their developmental age can be more like a 2-year-old. Or they can be chronologically 8 years old, and yet their developmental age is more functioning like a 5-year-old. Many times when I meet with parents, I'll ask them, where do you feel like your child's brain age is? How do they act? And it's so interesting because oftentimes I'll have a parent say, well, Amanda, there's moments when I feel like I'm talking to a lawyer or I'm talking to a very mature, highly intellect child. And then yet there's other moments that I feel like I'm dealing with a 3-year-old or a 4-year-old. Socially and emotionally, they're acting more like a 4-year-old. And so you can see the imbalance in skill sets. But what's interesting is that, there's this thought of like, oh, they're just going to grow out of it. When actually the research shows that that's not the case. Their symptoms may change as they become a middle schooler or a high schooler or a young adult. But remember how we talked about the risks? They're at a greater risk for drug abuse. They're at a greater risk for making impulsive decisions that can lead to incarceration. So the symptoms can change, but actually the research shows that actually their developmental age will look really different. That when they're 30 years old, they're more or less looking more like a 20-year-old, which is a 10-year gap versus when they started off at 4 years old and it's like a 2-year gap. So all to say that it's not that they grow out of it, it just can look like those symptoms can change where they may not be dealing with throwing themselves on the floor and throwing a 2-year-old temper tantrum when they're 14 years old, but yet when they're 14 years old, they may be extremely impulsive, and they make really impulsive decisions that can impact their life. Here are some symptoms of a child that has underdevelopment in the right hemisphere or the right, like a right brain weakness. They can be like, remember how we talked about motor skills. So a weakness and the right hemisphere is responsible for the development of gross motor skills. So you can see symptoms of awkwardness, clumsy, space invader. You can also see symptoms of hyperactivity, anxiety, difficulty reading facial expressions, lacking emotional control, because the right hemisphere of the brain is your emotional regulator. It's that ability to regulate emotions. You can also see a lot of immature social behavior, lacking interest in sports, of course, poor eye contact, space invader. So those are symptoms that you can see with a right brain weakness. Whereas symptoms with a left brain weakness is they can struggle when it comes to remembering facts and details. They can struggle with fine motor functions. They can struggle with low motivation, task avoidance, low verbal skills. So there are different symptoms related to a right brain weakness versus a left brain weakness. And here's a poll question for you. Which hemisphere do you feel like is driving your child's struggles? And do you feel like it's more of a right hemispheric weakness, a left hemispheric weakness, or symptoms on both sides? And which symptoms do you see your child struggle with the most? Is it more of inattentive and lack of focus? Is it impulsive, hyperactive? Is it difficulty with multi-step directions, difficulty seeing the big picture, task avoidance, poor memory to details, lacking emotional control? And you might say, oh my goodness, it's hard for me to pick because I see symptoms on both sides. And that is actually typical and normal. Because think about it. If your child has underdevelopment in either hemisphere, okay, even the strong hemisphere, you're not going to see the full potential because that ability to cross communicate effectively and efficiently is impacted. So you're not even seeing your child's full potential in their strong hemisphere or their weak hemisphere because it's all about development, and you really want to see them developing equally so they can cross communicate effectively and efficiently. And so oftentimes we can see and we hear that yes, there are weaknesses and you're seeing symptoms on both hemispheres of the brain because that brain isn't connected optimally, right? And when there's a disconnect, you can definitely see symptoms on both sides. So sure enough, you guys are saying 54% you see symptoms on both sides, and that is very common. But also that 71% of you guys are saying the inattentive and the lack of focus. That's something that's really critical. That task avoidance is also really critical. Difficulties with multiple step directions, of course, the impulsivity. So those are all very common when we look at symptoms and when we look at hemispheric weakness. So here's the thing. At the end, the bottom line is, here's what's really going on. The research says that if your child has difficulty with behavior, difficulty with focus, memory retention, academics, impacting their life skills and social skills, that it comes down to a lack of brain connectivity. A lack of brain connectivity, meaning that they can have underdevelopments in the brain that's impacting the way that that brain is cross-communicating. So the good news, like I said early on, is that we can strengthen brain connectivity, okay? We can improve the function of the brain, and that's the good news. And how do we strengthen brain connectivity? Well, when we look at it from a developmental perspective, we need to strengthen their sensory systems. So strengthen their visual system, their auditory system, their motor systems, gross motor, fine motor. We need to strengthen the area of the brain related to multisensory processing when they're having to listen, watch, and do motor movements simultaneously. So all of those things are really critical for strengthening brain connectivity. But we also have to look at which hemisphere is really driving the imbalance. And that's what makes brain balance really unique, is that we not only look at things from a developmental approach, but we also look at things from a hemispheric approach as well. And so here what we've provided for you guys is that you guys have a guide. It's going to be in the chat, but also you will actually get this emailed to you as well. Because here's what the research says, is that to strengthen brain connectivity, you need to activate multiple sensory input simultaneously with increased intensity over a period of time. What does that mean? Well, you need to activate maybe their olfactory system, which is smell. Smell is actually directly hardwired to the frontal lobe, which is the brake pedal of the brain. You can activate the brain through music. You can activate the brain through gross motor activities, through visual activities. So utilizing multiple sensory inputs simultaneously with increased intensity over a period of time is one of the most powerful ways to activate the brain. So what we have for you is we have this guide where we give you insight of different exercises and different activities that you can use to activate your child's brain. And this is a great guide for teachers. It's a great guide for family members that maybe are struggling a little bit with, working with your child or understanding what's going on in the brain of your child, because we do provide some insight to that in the guide. Also, too, we have many ADHD resources within our centers. So if you contact your local center and let them know that you were on the ADHD in the Brain webinar and that you would like the additional resources that are free for working with a child that is struggling with ADHD, we have this awesome homework survival guide for you. We have more information about how utilizing multiple sensory inputs simultaneously is one of the most powerful ways to stimulate the brain. So there's a lot more information that we can provide for you when you reach out to your local center. Here's what's also awesome, is this is now our research here in Brain Balance. There was actually a Harvard study that showed that the Brain Balance program was as effective as stimulant medication in alleviating ADHD symptoms in children. Many of our families that come to Brain Balance are looking for a drug-free holistic option. They really are trying to avoid the use of medication. And so this is actually research showing that the brain balance training had clinical, behavioral, and biological effects on par with pharmacological treatment, which is awesome. Because again, when you improve connectivity in the brain and that brain is able to process optimally, you actually see a reduction in symptoms. You see a reduction in impulsivity. You see a reduction in them responding out of emotions, and where they can respond more out of reasoning and critical thinking. Because when you reduce those primitive reflexes, integrate the primitive reflexes, strengthen their gross motor skills, strengthen their fine motor skills, strengthen their visual system so they have better focus and attention, they're able to fixate their eyes. All those strengthening connectivity in the brain actually reduces the symptoms of ADHD. So again, a connected brain is a teachable brain. And so the better that your child's brain is developing and connected, the less symptoms you're going to see of ADHD. And that's what's super encouraging and exciting. So here's what I would highly encourage you guys to do is take the next step, call the center, and book an appointment. Because the areas that we look at to give you answers, the first step is to give you answers of why your child specifically is struggling. We offer those answers through that next appointment where we look at, does your child have primitive reflexes? What are their sensory systems? How are they functioning? What does that visual system look like? What does that auditory system look like? Can they smell? Can they physically feel their body? Also, where are they at related to gross motor skills and fine motor skills? We also can look at eye tracking specific to academics, which is super helpful. So the next step is to just get answers specifically for your child of where are their strengths in brain function and development, and then are there any weaknesses that's impacting that connectivity in the brain? Now, hopefully this is super helpful information for you. Like I shared, we have several centers that are on right now. I'm going to answer some questions live. I think we have a few minutes left. And so definitely reach out to one of your local centers. But of course, I would love to answer some questions now. And then we'll talk about that. We're doing this presentation live again tonight at 8 o'clock. So that's something that can be super helpful for you. So if you have a loved one that needs to hear this information, definitely join us tonight. It's live again at 8 p.m. Eastern. And we absolutely will be able to share this information again. But let's see what questions you guys have for me this afternoon.
Thanks, Amanda. Are the changes that happen while a student is in brain balance long-term, or are they just while they're in the program?
Oh, that's a great question. Yes, they're long-term because we're building connections in the brain. I like to call them highway systems in the brain. Because if you think about if there's a 2-lane highway that you're driving on versus a 4-lane highway versus a 6-lane highway versus an 8-lane highway, right? The more connectivity you have in the brain, the better that brain's going to function. It's called the study of neuroplasticity, and it's actually building neuropathways. That's what we're doing, is we're building more neuropathways in your child's brain to have better brain connectivity. So it's absolutely lifelong change, because you're actually building better connections and more connections in the brain for them to be able to learn and socially and emotionally develop. Good question.
Thanks, Amanda. Why is it that the symptoms of autism spectrum disorder and ADHD are so similar?
Good question. Well, what we're finding now is that really it's all on a spectrum, right? It's just what they even are calling more and more of spectrum disorders. Whereas a child with ADHD, ADD, they have higher functioning. Maybe the disconnect in the brain isn't as great as perhaps a child with autism. But the research is showing is that all of these neurobehavioral disorders come down to a lack of brain connectivity. And so again, being able to customize a plan specifically for your child to strengthen the areas of weakness specifically for your child is one of the best ways to actually address any of those type of neurobehavioral disorders. Good question.
Thanks, Amanda. Is it important for a family to have a formal diagnosis prior to coming to Brain Balance?
Actually, no. We actually serve a lot of children where, again, parents are trying to look for a drug free holistic option. And so before having to get a diagnosis, they want to try, a drug free holistic option. So we actually serve many children that do not have a formal diagnosis, but yet they're experiencing symptoms. Perhaps maybe the teachers at school are sharing, that they're concerned, they're having difficulties with focus and attention. And there's reasons why. And I think that's what's really helpful about your appointment in the center is getting an assessment complete really gives you those answers of why specifically your child is struggling, because there can be different reasons why your child may be struggling with academics or why they're struggling with focus and attention. So we're not as much focused on the diagnosis as we're really focused on giving you answers specifically for your child, and then building and developing an appropriate program that's customized specifically for your child and your child's brain to strengthen brain connectivity in their situation and circumstance. So, yeah.
Thanks, Amanda. Could you give some examples of the types of exercises that a child might do during their sessions?
Sure. So we have two rooms in Brain Balance. We have what we call a sensory motor room and a cognitive room. In the sensory motor room, there are stations in the room. And it's really like a gym for the brain. We are so used to seeing gyms to physically work out our bodies, but yet it is a gym for the brain. So, as the research says, to activate the brain and develop the brain, you have to activate multiple sensory inputs simultaneously with increased intensity. So we absolutely strengthen your child's visual system, their auditory system. So some of the activities can be on the computer where we're exercising their visual system. They also will do balancing exercises. We also will do core strengthening exercises because gross motor also develops the brain. So they may have some physical exercises that they're doing. And then we do several activities that activate the area of the brain for multisensory processing. When your child's having to listen, watch, and do motor movements simultaneously, how well is that brain integrating all of those senses? So they hit different stations in the room. And when you go in for your appointment, you actually can see the rooms that they're in. You'll get a tour of the center. And so it'll give you a better picture of what they would do. But it's literally they hit different stations based on their customized plan. And then they go into the cognitive room. And in the cognitive room, they do cognitive exercises that strengthen the brain. It can also where we work on reading comprehension, math problem solving, written expression. So we can also strengthen their academics as well as strengthening just overall cognitive exercises to strengthen and develop the brain as well. So we work on all of that underneath in that iceberg that we showed you a picture of, where we want all of those areas to be strong and strengthened to have optimal processing in the brain. You can't just work on one area. If you only just work on the visual system, then you're not getting that connectivity. You have to work on all systems together to be able to get optimal development. And then the other thing is we do have a nutrition program as well, because nutrition is important for optimal brain function and development. So it's really sensory motor work, cognitive work, and nutrition, where we really work in all areas of your life and your child's life to be able to get optimal functioning. So hopefully that gives you a little insight, but definitely go into the center, take a look at the rooms. It's fascinating to see and can be super helpful.
Thanks, Amanda. We are getting a lot of comments about parents who, throughout their child's journey, have recognized symptoms in themselves or even gotten a formal diagnosis themselves as adults. what can they be doing to improve their own brain function?
It's a great question. We do have an adult program that launched about 2 years ago. And so definitely that is an option, is to actually do the adult program. So you just have to call your center and ask if they're offering the adult program. But also too, what I always say is that when you learn more about your child's brain, one of the things that we do in brain balance is we actually educate our families on lifestyles that also can improve brain function. Because there are certain things in your lifestyle that can also help with optimal brain function and development. So it's always fascinating when parents go through and actually um, learn more about their child, even because you can make changes at home that can also help you as an adult. So there's many options, but we definitely do have an adult program. And then also too, as you make changes for your child, as your child does specific exercises, you can do those exercises as well, which can also be helpful for brain change for you. So it's a good question.
Thanks,
All,
Amanda.
yeah. So I think do we have time for one more question?
I think we do. And we have a great question. Why is it that children with ADHD or similar disorders tend to begin to struggle academically around third grade?
That is a good question. Well, academically, between pre-K and second grade, okay, it's a lot of left brain academics. So the left hemisphere of the brain is, remember, it's responsible for pattern recognition. So learning your shapes and your colors. It's also about learning your letters, learning letter sounds, word reading. When it comes to math, it's about like numeration, addition, subtraction, multiplication. So it's very much more of a focus of left brain curriculum. However, because they're learning how to read, they're learning the basics of math, which are all patterns. In third grade, the curriculum shifts where now they're having to comprehend what they're reading to learn. And their math problem solving with word problems. There's a whole lot more word problems in third grade. So the curriculum shifts very much more to a right brain curriculum. And so oftentimes we can have kids that are gifted. And matter of fact, I was talking to a parent yesterday where their child was very high academically in pre-K, kindergarten, first grade, and second grade. And now they're in third grade and they're struggling. And that is because the right hemisphere of the brain is responsible for comprehension. It's responsible for drawing conclusions from what you read. It's those inferencing, that hidden meaning in text. So right brain is a lot more about comprehension. And so we do find many children that have ADHD or spectrum disorders, they can have underdevelopments in that right hemisphere that impacts their academic functions. And so what's really key is that once they hit third grade, a lot of academics go towards the right hemisphere all the way through middle school and high school because it's a lot of comprehension and drawing conclusions from what they read. So that's where you can see a difference in their academic performance. And what's also so fascinating is, they can be strong in certain math and then they can struggle in other areas of math, right? And typically it's related to what area of the brain that they're having to utilize. So it's really fascinating. All right. Well, like I shared with you guys, if you felt like, wow, this was helpful information, I need to get my significant other on to listen to this. We will be here again this evening, 8 p.m. Eastern, 5 p.m. Pacific. And it's live. It'll be me again live. We might have different questions, but absolutely, send the webinar link. It will work again tonight. So if you have someone that you feel like this would be helpful, this is a lot of content, we know, but definitely, I really hope that this was super helpful for you. You have a better understanding of why your child is struggling. Don't just focus on the symptoms. but understand that typically it's because of underconnectivity in the brain. And the good news is we can change their brain, we can improve the function of their brain. You don't have to stay and live in this place that you're living right now. So be encouraged. And thank you so much for joining us. And also, next month, we are actually going to be talking about the impact of adverse childhood experiences on brain function and development. So if you are, a family that have adopted children or have, your children have experienced hard things, or foster care, this is where we're going to be talking about the impact of adverse childhood experiences and how it does impact brain function and development. And again, what can you do about it? So it's a really great presentation, and that's what we're going to be talking about next month. So all to say, thank you so much for joining us this afternoon. I really hope this was helpful information. Be encouraged and know the brain can change. You can improve the function of the brain, and give our centers a call and get answers why your child specifically is struggling. Thank you so much, everyone.